So again, my name is Kate Gates. I'm here with a panel of volunteers. I have Dimmock, Lisa Boyd, Delarosa, and Barbara Murphy here with me. I'm really happy to be here talking with you all about volunteering with the Pulmonary Fibrosis Foundation, partly because we have great volunteers already, and partly because we have a lot of big goals that we're trying to accomplish. And the way that we're going to accomplish those goals is by having more of you all join in and work with us on meeting these goals. I wanted to talk a little bit, to give a little bit of context about what we have laid out in the Pulmonary Fibrosis Foundation's strategic plan for how we engage volunteers in this work. What kind of work are we asking our volunteers to do? The first goal that we have in our strategic plan is to work with patients and families. So you're going to hear from support group leaders today that are on the front line of that work. They are sharing their own experiences, they're bringing in experts, they are also giving the PFF's promotional or educational materials so that families are educated in that way. The second goal is to educate policymakers. This is something that we've really started in the past year and a half or so to do, is to make sure that policymakers are aware of the impact of pulmonary fibrosis in the community. Our PFF daughters are some of the people who are in the forefront of that work. We also have a third goal of educating healthcare professionals. So our PFF ambassadors, you're going to hear from a couple of ambassadors today, go to doctors' offices, they go to CME events, which is continuing medical education that doctors have to engage in. They've actually been involved in the creation of some enduring CME materials, so that they're materials that are online that are available for doctors, so that doctors, in addition to getting some of the really complex medical information that we want them to know, are also getting the patient voice. And that's work that we, again, think that our volunteers are really crucial for. Finally, educating the non-pulmonary fibrosis community is important. We need to make sure that there's more awareness in the whole US about what pulmonary fibrosis is, how many people it affects, what are some of the signs and symptoms where you should go to your doctor and say, I'm having shortness of breath, and make sure that your doctor is really giving you a complete exam. So as you can see, there's a very large goals, and we are really excited that we are going to have so many people here at the summit, so that you can help us to raise awareness, and we really would love for you to work with us on reaching these goals. So now I want to have our panel talk more about how they engage in all of these things. I'd like to start out by having everyone introduce themselves and describe how they first became involved with the Pulmonary Fibrosis Foundation. So I'm going to start at the other end of the table with Anne.
Sure. Can people hear me? Okay. So I found out about the first summit that the Pulmonary Fibrosis Foundation held when it was called the IPF Summit. And we were starting to do some small clinical trials related to IPF, and I thought, oh, this would be an interesting thing and we could learn. And pretty quickly figured out that the people at the PFF were very interested in engaging people across a broad range of expertise. And you know, I was there as a basically new research coordinator and support group leader, and mostly just wanted to learn, and they, you know, seemed to think that I would still be able to contribute, which I thought was misguided at the time, but here I am, so I guess it's okay. And so then, you know, as the PFF has grown and has grown their programs, you know, we've become more involved with the care centers and different things, but that's where it started.
Great. Lisa?
Good afternoon. My name is Lisa Boyd. I'm from Chicago, and I became, first learned of and became involved in the Pulmonary Fibrosis Foundation when my father passed away from the disease in January of 2012. I currently work with on the Daughters program, and we work in I guess a three-tiered for advocacy, awareness, and fundraising. I absolutely love it. It gives me a great pleasure to be a part of such an energetic, passionate community, and that is singularly focused on finding better treatments and a cure. And it gives me great hope, because I always wanted my father's story to not end with PFF, but to end with a cure for PFF.
I'm Dr. Hello? No? Yes? You can't hear me? Or you can? Okay. I'm Dr. LaRussa. I was going to say howdy. I'm from San Antonio, Texas. And I was diagnosed in 2008. And that's how I got involved. I researched, I looked online to see anything I could find about pulmonary fibrosis. Via a lung biopsy, my doctors mentioned pulmonary fibrosis. I'm like, what the heck is that? They mentioned lung transplantation. I'm like, what is that? I didn't know. So of course I went to the web, and here comes up the Pulmonary Fibrosis Foundation. I met with, or spoke online with Leanne Storch, and whatever information, whatever materials they had back then, she sent me. And that's what got me started, and here I am, 2000 and almost 18, and it just gives me more of avenues and how they've grown to help me to be more educated, and why I'm here is because of them, and started a support group because of them, and got information, and well, I don't want to say it all, but anyway, it's a wonderful, wonderful organization, and I'm just grateful to be here, and I'm telling you, they've grown so much since 2008, and I'm just so excited for what's happening now and for the future, so thank you.
Great, thanks, Dot.
Hello, everyone. My name is Barb, and
Sit on.
like this?
Is it on?
It's on.
Yeah, it's on.
Maybe. Can we?
All right, okay, I think he's going to fix it. All right, in the meantime, I'm going to use Dot's. Wow, hers is pretty powerful. Where was I? I was first diagnosed with IPF in 2003, and I started a support group in 2004 for people with pulmonary fibrosis. And I first started it with with just a prayer, I guess, and then I became involved with the PFF about a year or two after I started the support group. And as Dot mentioned, it was much smaller then. I'm saying this is around 2006. It was a much smaller group at the time. It's grown tremendously since then, and it does so much good now that I'm very proud to be a part of helping to spread the word, and I'm also a PFF ambassador at this point. So the more involved you get, the more you appreciate the work that the foundation does.
Great, thank you all so much. I'd like to go ahead and get started asking people more specifically about their roles, about some of the experiences that they've had. So Dot, you mentioned that you run a support, oh, sorry, nope. Yep, there we go. Okay, Dot, you mentioned that you started a support group. So how did you find a place to hold your group, and how did you get your first members?
Yeah, well, we started off at a little Chinese restaurant, and to this day, I don't even remember how we found each other, but we did. I'm assuming online with a little Facebook. Started on Facebook, and I put on there San Antonio Pulmonary Fibrosis Support Group, and somehow they found me, and we started meeting at a little Chinese restaurant, me and 3 other little old ladies, and then our church had a little hall, and we asked them if we could use that little hall for them. It was for convenience sake and for privacy, and we started using it and continue to use it to this day.
Great, thank you. Barb, I'm going to ask you the same question because this is a question we get all the time from people who want to start a support group, and they say, I don't know where I'd hold it, I don't know how to find people, and I think your experience is perfect because that's how so many groups start, just a small group of a few people who want to have the community and have people to talk about and share experiences with. So Barb, what about your group? How did your group get started?
Well, I first tried using my pulmonologist to help me get the support group started. And the first thing I did was I created like a flyer kind of thing and looked for people to come and join the group. Didn't get much of a response from his patients. But in the meantime, I was searching for a meeting place, and it was not easy. I was telling our volunteer group earlier today, I would call places, tell them what I wanted the meeting for and who would be attending it. And as soon as they heard that it was people who were ill, they kind of backed off a little bit because of probably insurance purposes. They were concerned that if somebody was sick and they had a problem while they were on their property, it would be difficult. So then I wound up calling hospitals, and I finally did find a hospital, a respiratory department that was willing to help us get a room in the hospital and a conference room. And that's where we've been meeting now for, oh my gosh, I guess about 10, 11 years, because we've been in existence for 13 years. So we meet there the last Wednesday of every month, regularly, 12 months a year. And they take care of making sure that we get the conference room that we have year after year after year. And as far as getting people to become members of the group, I wound up putting articles in newspapers, in my local town newspaper, in the newspaper around the hospital, and also in other adjacent towns nearby. And we started drawing from those communities with people who would come. And then eventually it was a lot of word of mouth. And now most of the referrals I get are from the Pulmonary Fibrosis website. People who have seen my name and phone number with the support group information, they call me, and that's how we get our members at this point.
Great, thank you. A lot of good information there. Just from a Pulmonary Fibrosis Foundation standpoint, we do have resources if you're interested in starting a support group. We have a support group leader guide. We have a series of webinars that support group leaders did. We will put you on our website so that people can find out about it that way. If anyone is interested in any of these volunteer opportunities, I'd like to ask you to fill out the form that should be at your table, one of the forms. Put your contact information on there, which opportunity you're interested in, and someone from the PFF then will contact you. That'll help us to get the right person calling you so that you talk to the person who works with the specific program. So for any of these things that we're talking about, please use that form, and one of us will get back to you. I wanted to stay with the support group leaders for a minute to ask what a typical support group meeting looks like for each of you. So Barb, I'll start with you. What does a typical support group meeting look like?
We vary our meetings between speakers and then just sharing sessions, I'll call them. Let me take, for an example, a sharing session. When people come to the meeting, we give an update. Each individual gives an update as to what has happened during the past month. Have they been to see the doctor? What did the doctor say? What are their questions? We have some pretty lively debates, I'll tell you, with some of the questions that the people ask, that the members ask, and also some of the information that is shared. We really, I can remember at the very beginning, there was a lot of discussion about disability, people who had gone through the process of applying for disability with this disease. They had some good information, and they were able to share that with other members who were also thinking about doing that or in the process of doing it. Another area that we will do a lot of discussion about just amongst ourselves is oxygen therapy, portable oxygen concentrators, what's the best one, what should I get, you know, how useful is it? That type of talk. So a lot of that is just the mutual problems of living with IPF and then trying to help each other resolve some of those problems with some solutions. When we do have speakers, it can be from anywhere. I remember early on we did have a representative from an oxygen company. Recently, we had a technician, a transplant technician from Temple University who was extremely informative. We had a great discussion and after he spoke, and you know, things like that that really are kind of like the mainstay of our meetings. Getting speakers in, arranging to have them come, and that sort of thing. And then the sharing portion of it is really beneficial.
Yes, thank you. So Dot, I'd actually like to ask you a slightly different question, because I know you've also been involved with the Care Center Network in San Antonio. So what are some of the sort of special events that you've done with the Care Center Network?
It's such an honor. One of the doctors from the hospital that I was transplanted at, I needed a transplant after my diagnosis, we started a free clinic. We wanted to have a clinic so that people that couldn't afford to go see an interstitial lung disease expert, ILD expert or IPF expert, to come to without charge. And so we started having these free clinics, and it was open to anybody at all. And we were able to get the RTs, the professors from the RT department also to come in, and some of the students. And so we do the 6-minute walks, and we do PFTs, and Dr. Nambiar, with all their information, would give them basically a second evaluation of sorts, to give them a second, just to let them know, you know, what indeed they did have or did not, because a lot of them were like, well, you know what, there's no hope for me, and they're desperate. And so we were giving them hope. And so what we were able to find out was a lot of them were misdiagnosed, which was good news for them, and then others did have IPF, and some of them we were able to help, and others, of course, not. So we started that, and then we've also, we do that yearly, sometimes twice a year if we can. We get all the mechanics together. And we've also started a bereavement support group, because, as you know, a lot of our loved ones, they just don't make it, but we become a network family. So what was happening to the loved ones, the widowers, the family members, they needed a place to go, and they're part of our group. So we started a caregiver bereavement, which has been wonderful, you know, and so we are able to facilitate in that aspect as well.
Great, that's really, I love seeing the pictures from your events and all of the things that you do that really make it a community and make it somewhere that people can get that support and feel like they're not alone in all of this. And I'd like to ask you about the educational event that you all did at your center. I also don't think I exactly introduced you, so if you can tell people your role and about the education event that you all have held.
Sure. So I'm Dimmock from Penn State Hershey in Hershey, Pennsylvania. And I wear a couple hats. I'm a support group leader, but I'm also a research coordinator, and I help coordinate clinical trials and things like that. So our care center did a combined patient education and CME event, which I'll confess I got the idea from what the PFF does with their summits. And so we had providers in one room, and then right next door were the patients and caregivers, and we were able to bring in an outside speaker because of the support from the PFF. And we have, I'm not sure, let's see, I'm trying to remember, but we got a whole bunch of materials from the PFF, which was great because people could take things home with them and read more. The other thing with our care center events, so I'm going to shout out to two of our support group members who are here. We asked about what we should do in the month of September for pulmonary fibrosis awareness, and somebody said, oh, well, what about the Apple Festival? So I didn't know there was an Apple Festival, but it's quite a big event in a town sort of next to where we are. And so we were able to get a booth, and we had a bunch of materials about pulmonary fibrosis, and we had members of our support group there who could share their story and answer questions. And then we had pulse oximeters, and so when you think about needing supplemental oxygen, that doesn't really mean anything to most people. And so having a pulse oximeter, and you can say, you know, so if I were to do this without my supplemental oxygen, like this number would be low. Most people, it's, you know, 95, 99. And I think that helped engage people a little bit. And we actually just encountered a couple people who had experienced either a family member or themselves with pulmonary fibrosis. So we have a couple people now who are hopefully going to come to our support group. So.
Great, thank you. I mentioned earlier that we're doing a lot more with legislative advocacy and government affairs now. It's something that we've consistently heard from you is important, that you think that we need to make sure that policymakers hear the voice of the pulmonary fibrosis community. So Lisa joined us in DC, actually a couple of times in the past year. Right. So would you talk about your experience on Capitol Hill, and if you can also talk about what did you know going in, what were some of your thoughts and thoughts going into it?
Sure. So my first experience was in May, and I was so nervous. Because I just had this idea, I'm going to Washington, I'm going up on the Hill, I'm going to be talking to people who are really busy, and this is not going to be a top priority. And I can tell you I was so pleasantly surprised and pleased at what a warm reception we received. We had an opportunity to talk to office people who are dedicated to the healthcare issues. We met some of the senators, some of the representatives, and what we found is that there is a very large bipartisan support for health-related issues. And what I loved about what we did was we got to bring the human aspect to it. We got to tell our stories to people and let them know that this is, while they're up here at a 30,000-foot view looking at maybe the financial side of it or different aspects of it, we're the human face of disease. And it was a wonderful experience, and I look forward to doing it again. And I think it's so important because we're the constituents. We go to see our congressmen and our senators, and they're representing us, so they need to know what it is that we want from them. And very rewarding, and it's really important, and I love the fact that the foundation is getting even more invested in it.
Can I add something to that? So I actually haven't been to the advocacy days, but I wanted to just let you all know. So the two medications that are approved for IPF, the FDA put together basically an event where they wanted to hear from patients, and they learned about pulmonary fibrosis, and not long after that, they sort of fast-tracked the approval for those two medications. So this really can make a big difference.
That's right. It definitely can, yeah. And I would say not everyone's going to start a support group, not everyone is going to become an ambassador necessarily, but this is something that pretty much everyone can get involved in. Even if you're not going to DC, we're going to provide a lot of opportunities for you to share your story. Like Lisa said, give the human face to the issue. So as we send out alerts about that and provide updates, I would love for everyone in this room to get involved, because your legislators want to hear from you and they need to hear from you so that they understand what's happening in the community. So that's very important. I want to go ahead and move on to questions. We probably will only have time for 1 or 2 questions, but first, since many of you are interested in the role of the ambassador, I'd like to ask Dot what she hopes to accomplish in your role as an ambassador.
We all have a story, and it needs to be shared, and if we can inspire, maybe we can't save the whole world, but we can imagine a world without PF. What we can do, our little part in our little part of the world, it matters. And so as an ambassador, we want to bring awareness, I want to educate, and I also want you to know that I too have been diagnosed, so I can understand and relate to not only the patient, but now post-transplant, live to tell about it and to be that encouragement. So I just want to be able to be that inspiration for you, let you know that I, from nothing, having no background in any education as far as medical education, we start a little support group, and that little support group has been something spectacular, I say, in my viewpoint. But we are a care center. We have this free clinic. You know, we have this bereavement. We have this caregiver. I was just asked, I just was asked from one of my first members. She was the last one that passed, and she lasted a long time. Her daughter just asked me to officiate her funeral, and I did that on Friday. What an honor. In a million years, I never thought that I'd be asked that, but that's how important we are. That's how important this message is. And as an ambassador, just know that we know that, I know that, and we just want to be that encouragement for you. So as an ambassador, I just want to be able to serve the PFF. Kate asked me, Dot, will you just, I'm like, you know I'll do whatever you want because I'm your ambassador. This is my passion. And I inspire y'all that maybe you don't have a lot to say, but what you have to say, it matters. And if you don't know what to say, we got a lot of people up here that will help you along the way. But really, it just takes you being willing, and that's all it takes. So
I think that's a great way to finish up, Dot. Thank you. I think for each and every one of you, your story and what you can share of your experience with other people is one of the most valuable things that you have. We have time for just 1 or 2 questions if there's anything burning for anyone. Okay, in the back.
I was just wondering if you have to be an ambassador to become a daughter.
No. So the PFF daughters are a different group that you can apply for completely separately. So if you want to mark on there that you're interested in becoming a daughter, then we can start sending you information about that. Mm-hmm.